But while I have discussed all the areas that it is of benefit, we all know that nothing comes without a cost to it. Data are never without bias. If data are always collected from a single source, from a very selective population, when the tools that are going to be developed by these are going to only predict about those people. So the information that will be used from that population may not be of any benefit to the rest of the world. Inequality. I mentioned many tools that are being developed, but if they are for a cost, then not many people in the world are going to afford using them. So it may result into inequality. We have, as humans, we have the tendency of over-reliance, and I usually give the example of use of lab tests and diagnostics. When you go to a doctor, they hear your complaint, and the next thing they do, they write tests. You have to do an MRI, CT scan, blood works, etc., etc. Um, if that also happens with AI, the chances are that if we do not give feedback to an AI tool, it will rely on the information that is provided and it will self-learn, and it may not be as beneficial as we think it is. So a human oversight is critical in this case. Similarly, if I'm only interacting with my watch, with my car, with my screen, and I'm going to a hospital where there is no human, I will lose a human touch. And that's why I started with arts. I showed you guys some art pictures. So while I have access to the best care in the world, but I don't have anyone to talk to. And even if I'm talking to someone that may be a robot, I don't want to picture a scary world. But if that happens, then how is it going to look for all of us? AI is based on data. If I don't have access to your data, or you don't have access to my data, then I'm unable to build a good quality AI tool. But that means that I have access to all your information. So where do we put confidentiality and data security into it? It could be used for misinformation. If we put in wrong information into an AI tool, it is definitely going to give you wrong results. These are never going to be 100% sensitive and specific. So they will not predict the the actual status of my health. So we have to be wary in terms of that. If an AI tool is saying that uh, I may have some kind of cancer. So how accurate is that is a critical question, and that is where we are working. Um, I mentioned accountability, and I think that's a greatest contribution it can do. But at the same time, accountability of the tool is also of question. If I develop an AI tool, so then who is accountable for the errors, for the harm that it may cause? Um, that is why it is important. I think that's a key message that I want to give for all of us. And in the first slide, in the last bullet was about it. While there is huge expectation, we are thinking of a world that is going to operate efficiently, effectively, faster, with a lot of AI tools in it. The question is that how we make sure that it is the benefits outweigh the risks. That is why it is important for us to know what tool is going to be used, what information am I giving, ask questions, talk to the people who are developing it, community engagement. And my dear friend Alpak is in the audience, and he has been my mentor and a great friend. In terms of understanding the community perspective, if we are developing these tools for people, what do people think about it? Do they need them? Or we are imposing a need that is benefiting us on them is a really, really critical question that we all have to ask ourselves and make sure that we work for it. Um, Humans first. Of course, machines are going to be there. For example, tomorrow we have 8 billion robots who are the best physicians and surgeons. Because right now I am a physician, but I cannot be a surgeon. So maybe we'll have robots who are physicians, surgeons, neurosurgeons, gastroenterologists, everything in one tool, everything in one person. So, but then what are the humans going to do if I'm going to interact with the robots only? So what else? How else we can contribute to the global knowledge and global economy? Um, Fairness is really important. While we know the benefits, if it is not reaching everyone, then probably it's not a useful tool. Uh, be cautious, be curious are some of the things that we need to understand, and we need to always emphasize on. With that, this is what I wanted to share. I hope you guys um, you have questions. I'll be happy to take few.
Yeah, I have one. Since you work in global health, um, are there ways to aggregate this data to identify novel applications of existing drugs, sort of like in the US where we have off-label uses, um, so that would expand treatment without having to do new drug development?
Yes, I think that is an area, as I mentioned, when I was in Cape Town in that meeting, this was particularly discussed. One advantage of AI maybe in future is that previously all the drugs that were developed were in the institutions in the West. So it will increase the access for scientists in the developing world to come up with newer drugs. And we all know that diseases, pathogens also have diversity of their presence. So they are not prevalent in each and every area. Um, a drug that may be developed in New York may not be usable in Fiji, for example. So that is which is called as democratization of AI in our world. Uh, mm, but I think it will take some time for this to reach that scale. The developing world, as yet, is still in that follower mode. Still, the more challenging, the more uh, ideas are coming up from the institutions in the US and in the Europe. But this will help in collaboration. So if we encourage and increase collaboration between institutions with the countries in Africa and Asia and South America, and I think that will definitely result into coming up with new drugs, with new interventions, and also looking at their efficacy.
Yeah.
Thanks.
Imran, can I ask a question?
Sure.
Uh, one of our big problems was vaccine hesitancy, which we worked on, which was huge during the COVID epidemic. And I'm just thinking that if you can collect this varied data, like you were mentioning, that at the community level even, because we know a lot of predictors of it. There's so much research on it. I wonder if it'd be possible to predict where there will be, and if there's another epidemic or pandemic, where how to construct interventions that can help people get vaccines. That's what I was thinking. AI would probably help a lot if you could collect local community data. Of course, it depends on how deep the data goes too, because there's a lot of community issues, in terms of early responses to vaccines or difficulties. And, there were vaccine deserts in some places, and there's so many different variables. But there could be predictive models to deal with vaccine hesitancy. I think people are probably working on that.
Yeah, definitely. There are many groups that are working on this topic as well. But I think it also relates to the question that Gary asked. Uh, one of the reasons for hesitancy is where is the intervention coming from? And it
Yeah.
is much easier to pick up on an intervention. Let it be a drug or a vaccine or a diagnostic. I don't know. Somehow, vaccines are the primary target for distrust. Um, but if these vaccines are developed or these interventions are developed in that country, so this argument then stays invalid that, oh, they are trying to target you. So I think
Yeah.
that may be a contribution, that working in drug development or vaccine development in the developing countries may be beneficial. Um, but that should not be the problem in the US, because the vaccine was developed in the US and it was being given to the US population. So why are the Americans hesitant to a vaccine? I think apart
Mm.
from collecting that data from the communities and trying to understand why are they hesitant, I think the trust between the patient or the recipient and the provider is a critical area. A lot of doctors themselves do not believe in a vaccine to be a good or cost effective solution. So I
Mm.
think what AI can help is to come up with, for example, let's go back to 2019-20, the pandemic. If all that information, of course, there, for example, Johns Hopkins University had this map where they were looking at, okay, where are COVID vaccines and
Mhm.
where the vaccine is used, but it was much delayed, right? I mean, the
Yeah.
information would become available in a week or 10 days time, and the analysis will be done. So if those kind of mappings are done and that map is translated in a language that the person will understand, and I take blame for a scientist not being able to speak the language of people,
Mhm.
is it has been a major barrier in explaining why someone should take a vaccine or not. So if we can, for example, a chatbot or any other tool that we can use that can give you the answers. For example, I say, oh no, this vaccine causes, let's say, uh, results into brain death. So similar at the same time, if the AI tool can come back to me and say these many vaccines were given, these many vaccines were given globally, these many vaccines were given in your area, and there's not a single report of brain death. So although you think that it causes this, but there's no scientific evidence. But I think since I'm a scientist and you and I, we have worked on vaccines, so I'm a little bit more. But we need to work on those interpretations and the communication
Right.
approaches
Yeah.
when we are trying to reach the communities. I hope I have answered your question.
Yeah. No, 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 no. I didn't think about the chatbot as being a dialogue. They could have a dialogue
Yeah.
about with more information. You know, one of the things working in communities that kind of came out was that people have different priorities than the health workers sometimes assume they have. Like exactly what you said, like they create, an AI program for health for a community somewhere, but the community people haven't had input on what are their priorities for health. So it's that kind of interaction seems to need a human response to help train those AI tools. In other words, if it's only done by physicians or public health people, it's missing the local priorities or
Yeah.
issues. Yeah, yeah,
I think one advantage this phase of global health will have, and we have always talked about multidisciplinary approaches,
right.
right? We have always talked about it, and we have never been able to do that, right? Uh, because of challenges. And I think this is a time where you cannot develop an AI tool without bringing in different disciplines together.
Yeah,
You have a computer
yeah,
scientist, and computer sciences itself has like 10 other fields.
mm,
Machine learning or experts are different from
right, right.
um, I don't know, designing. So computer scientists, health scientists, physicians, and we know that your and mine approach of health is very different from someone who is always trained in a hospital, but they are the experts.
Yeah.
Let's say for COVID, right? And then the community, and then the policy maker, and then the regulator, and then the licensing body. So if we have to come up with something that is very useful, all of these um, disciplines have to work together. So
Yeah.
that is a hope for me, that finally we'll bring people together so that we can come up with a solution that takes into account everyone's expertise.
Yeah. Yeah. No, it's a great point. It's great.
Any other
Yeah.
questions?
Oh, just another question. I don't want to ask too many questions, but during COVID, there was a lot of money put out there for predicting the next pandemic. Do you have any idea where all that research? There was an enormous amount of research starting up and trying to come up with models of where of looking at different pathogens, um, I don't know. I haven't been following that. I don't know where that
Well,
it's gone.
I'm I understand that you also have a session on AI for global health security. So probably the
Yeah,
speaker will talk about that then.
right, exactly.
But based on my knowledge, AI is nothing without data. If people are not going to share data, you will never be able to come up with a. So there are different layers. Number one, you should have data. Number two, the data should be of good quality.
Yeah,
It should be generalizable. It should represent the whole population. Then you will be able to predict. And predicting a pandemic, the major challenge that I foresee is that if you don't even know the disease, then how are you going to predict?
yeah,
And I think that is where the models from AI can help. For example, if we are taking blood samples from all the 8 billion population every day, human eye will miss it if there is something um, not regular or not routine.
yeah,
But if one person somewhere in the world says that, okay, I'm seeing something that I should not be seeing in this blood sample, and if they mark it, then AI can read it across the globe. And if they see 3 or 4 other similar slides or any other sample, then they may collate this information and may be able to try to predict what is happening.
yeah, right.
There is a lot of investment going into it, but you and I, we have worked a lot in the field with the governments in developing countries.
Yeah,
We are not that close to having that data. Even if this data will come, this will come from a select hospitals
right,
in
exactly.
few countries.
Yeah,
Um, but
and it has to be democratized. Everybody has to have access to it,
yeah,
or to
and
input, or yeah.
yeah. And a lot of people have concerns about data, that they're saying, okay, if we share the data, everybody can use it. And they are scared that the large technology companies are going to use it.
Right.
And since they cannot
Make money.
compete with the
Yeah,
large technology companies, so they are not really comfortable sharing data.
yeah, right. Yeah.
All
No,
right.
this was great. This was great. Really wonderful. Yeah. I
I
really
hope
learned
you
a
guys
lot.
found it useful. I
Yeah.
just, it was a conversation. There was nothing technical or algorithmic, as they say it in AI. But yeah,
Dr. Khan. Thank you, Dr. Khan.
Yeah,
thank you very much. Appreciate that.
Wonderful.
Pleasure. All right.
Really
Very
Thanks. Bye.
extremely interesting.
Bye.
Thank you. Thanks a lot. Bye, everybody.
Bye.